Good afternoon, everyone. This is Lisa from Clinical Works Webinars, and we're going to go ahead and begin our class today for our patient-specific price transparency. And this is going to be for our Surescripts Partners webinar class. So we're going to have Luke Forrester Broughton. He's going to be the one who's going to be presenting today. We are going to take questions, and we'd like for you, if you would, please to hold them until the end. As they occur to you, if you would like to go ahead and type them in, please feel free to do so, but we'll actually stop and take the questions at the end of the presentation today. If in the case that GoToWebinar has an audio interruption, you can type in and let us know that there was an interruption and you lost what we were saying, and if we need to repeat it, we can do so. If there is an interruption, it usually auto-corrects itself within just a second or two, just to let you know. So you can just sit tight and it should just auto-correct. But if you miss anything we're saying, don't hesitate to let us know. Now, Luke is, he manages the electronic prior authorization product portfolio for Surescripts on the Surescripts product innovation and strategy team. He has extensive experience developing, managing, and supporting healthcare IT products. He's also actively involved in the NCPDP Electronic Prior Authorization Task Group. Luke does have a BA from the University of Northern Iowa and an MA from the University of Minnesota. So I'm going to turn this over to Luke now, and he's going to take the presentation and be able to share some information with you today.
Thank you, Lisa. Hello, everybody. Thank you for coming to the webinar today. So as you all know, price transparency and prior authorization are huge industry challenges at the moment. And I wanted to spend the next 30 minutes or so discussing how Surescripts and eClinicalWorks are partnering to address these issues for eClinicalWorks users. So studies have shown that about 10% of people who abandon medication end up doing so because of cost. And what we've seen is that even a difference as small as $10 could make a significant impact on whether or not the patient ends up picking up their prescription. And so being able to see what the price of a drug is and what the patient's out-of-pocket cost will be when they get to the pharmacy is something that patients are starting to expect more and more from prescribers and their staff members. And so we want to really talk about and focus in on how the Surescripts solutions within the clinical workflow can help bring that better price transparency to patients and providers. One exciting thing that we've seen from some early results, and this is with the Plan Health System in Georgia, is that for one patient this year, they were able to achieve over $6,500 in savings because they had the ability to check and see what that patient pay would be during the e-prescribing process with that real-time prescription benefit solution from Surescripts. So if you can imagine being that patient and having to foot the bill for thousands of dollars worth of prescription drugs, but for your provider to have the ability to see that there were more clinically viable and appropriate and financially viable medication options for you when you were there with them in the office. Just think about the power of that and how much of a hassle and a headache that's going to save you in the long run. So it's just some really exciting results, and we see these kind of examples all the time where patients are on expensive drugs, whether it's a specialty drug or a combination of drugs, and they're just very, very costly. And so having that price transparency available at the point of care is a big deal. So if we think about how price transparency empowers both patients and providers, you know, when I was at the eClinicalWorks user group a few weeks ago, I talked to a lot of people that were telling me about the importance of being able to have that price discussion when that patient is sitting at the office. And so being able to have that patient-specific price transparency delivered from your patient's health plan at the point of care is really going to be a significant increase in the level of functionality and the visibility that you have into into that out-of-pocket cost. And so from a price transparency perspective, we're really looking at 4 main areas that we're positively impacting by giving physicians that information that they can act on at the point of care. So it will not only increase first fill prescription adherence, but it's also going to increase patient satisfaction and make sure that those patient costs are manageable. Because as a physician, you want to make sure that you're putting your patient on a medication that will be viable financially and clinically for the long term. And that's really what we're focused on at Surescripts is making sure that you're prescribing medications and have full visibility into their financial viability long term, to make sure that they're part of that patient's pharmacy benefit and not just finding them something that would work for the first fill, but then something that would become financially more and more troublesome in that second and third fill. So we want to make sure we're putting the patient on something that's good for the long term. And just from an operational efficiency perspective, as I'm sure you all have to experience at least once a day, if not several times, where your patients leave the office, they go to the pharmacy and pick up their medication, and then for whatever reason, either it's too expensive or requires prior authorization, and then you've got pharmacies faxing and calling and reaching out to your offices to change something. And oftentimes the patient would also call as well if they're particularly upset about not being able to pick up their prescription that you prescribed. So that operational efficiency about seeing that out-of-pocket cost while the patient is still there with you and being able to make an informed decision to a different drug if that's feasible, that's a really powerful tool. So if we think about price transparency, really what we're trying to do here is layer on to that existing eligibility and formulary data that's been available to eClinicalWorks users through the Surescripts network for years. So we've been running the nation's largest e-prescribing network for almost 20 years. And our network alliance that we've been able to convene includes virtually all of the EHRs, PBMs, pharmacies, and clinicians in the country. So we're the only convener of a network at that scale. So unlike some of the other solutions in the marketplace, what that means for us is that we have access to the most up-to-date patient-specific information that's coming directly from those PBM and health plan stakeholders in real time. So when we think about real-time prescription benefit and electronic prior authorization, we're really building on all of those existing e-prescribing capabilities that you already utilize Surescripts for through eClinicalWorks. So as you can see in this diagram, really that first part is that eligibility and formulary data. So traditionally, that would have been the best information that you would have had during the e-prescribing process to identify who that patient's pharmacy benefit manager was and what drugs were appropriate based on that patient's pharmacy benefit. But the problem, as I'm sure you're all well aware, is that that information is at the group level. So when you're looking at formulary status and possible need for prior authorization and copay, all of that is information that the PBMs have delivered traditionally to show what those factors are for that patient's health plan or their group level benefit. It's not patient specific. And so the real key thing with real-time prescription benefit is that we're able to add an additional layer and show all of those same factors, but at a patient-specific level. So we'll give you that transparency that eligibility and formulary data has not been able to provide up till this point because the technology up until now just didn't support that patient-level detail. So the other nice thing is that once you've identified that patient-specific detail, you'll know for that patient and drug and health plan combination if prior authorization is required. So you no longer have to wait and send that prescription to the pharmacy and then get that call or that fax back saying, hey, prior authorization is needed and the patient couldn't pick up the medication. You can identify that at the point of care and be able to initiate that EPA and get it completed before the patient even leaves the office. So just imagine the administrative overhead and the hassle that we're able to affect by having that upfront rather than making sure having that all happen at the pharmacy. And so the end state and really the ultimate goal is that e-prescription that you're sending to the pharmacy can be dispensed and picked up by the patient without any issues at all. So being able to identify all of these things at the point of care and get that prior authorization complete and make sure the patient is on a medication that is financially and clinically tenable for the long term is really our end goal. And having all of that and sending that clean prescription to the pharmacy will save you so much work on the back end. So if we think about what does true price transparency look like, think about a couple different solutions, and I'll actually launch a poll at this point. So if you're thinking about which of these scenarios offers true price transparency, oh, sorry. So, oops. Sorry, I think I launched my poll a little early. So sorry, some of you might not have been able to see the screen, but really what we're trying to show here, or if you think about which of these represent true price transparency, scenario A, in which you've got eligibility and formulary data at the group level versus, and also having cost-based on historical claims data, and then prior authorization requirements. So that's scenario A. Scenario B would be having that cost based on patient-specific benefit plan, therapeutically relevant alternatives and associated costs, different channel options, so being able to see how much that drug will be at retail, mail order, and specialty. And then also being able to see what that patient's drug spend is for their deductible, and getting all of those same coverage alerts like age and quantity limits, PA requirements, and step therapy. Which of those would you think represents true price transparency? And what we would say at Surescripts is that it's really scenario B that would be offering that true price transparency. So unlike some of the other solutions in the marketplace, not only are we able to deliver those channel options, so if the patient has a mail order benefit, that will be cheaper over that 90-day period than the retail mail or the retail price would be, we can show that. If they have a specialty benefit, we can also display that. But I think the most important thing from our standpoint is that we are not, unlike some other solutions, using historical claims data and then trying to triangulate what we think that patient's cost will be. We're pinging the PBM directly and hitting the same system that the pharmacy would hit when they're running the claim. So we will be able to display exactly what the patient's out-of-pocket cost will be when they get to the pharmacy. And that's really where the power of our solution is brought to bear. So we're hitting that PBM's pharmacy benefit directly to make sure that whatever the physician is prescribing will be in line with that patient's pharmacy benefit in the long term. So our central goals with real-time prescription benefit is really about achieving that efficacy and affordability. So being able to see up to 5 therapeutic alternatives from PBMs if they're appropriate. If there aren't 5 alternatives, they'll just return as many as they think might be viable. But really giving PBMs the flexibility to send the provider back as many relevant alternatives as possible from a therapeutic perspective. Being able to deliver those 3 channel options, as well as that medication cost and copay information, and the drug spend towards the deductible. So while you're sitting there with a patient, you'll be able to give them an exact picture of what things will look like when they get to the pharmacy. And it really gets back to that trust factor. They are going to trust that the information that you have available when they're sitting there with you is accurate, and they want to make sure that that's the same information that would be available at the pharmacy. And being able to maintain that trust and have them know that the information they're getting when they're sitting in your offices, that's a really key component of the relationship between the patient and the provider. And real-time prescription benefit really enhances that level of trust between patients and their physicians. The really exciting thing is that because this is going electronically and we've got that connectivity on the health plan and the PBM side, that real-time patient-specific medication information is going to be back in your workflow in less than 2 seconds. So not only will you get back information on on that out-of-pocket cost for the patient, you're going to be able to see that across all of those alternatives and channels in a very, very short amount of time. So you're not having to wait and keep pinging the PBM to see and check different things. You'll have that actionable data available very, very quickly. And then if we're thinking about electronic prior authorization, again, because Surescripts has that fully electronic connectivity on the back end with our PBM and payer partners, when you send that electronic prior authorization, a lot of times the PBM is able to run those electronic answers through their adjudication system and return a response very quickly. So it's roughly 65% of the time, if that EPA will be approved, the PBM is able to return that approval in less than a minute, which allows you to secure that prior authorization and send that clean prescription to the pharmacy. So if you think about the amount of time in a manual workflow or a portal-based workflow where you have to go out, type in all of your information again for the patient, the drug, and the patient's insurance information, and then wait for the PBM to process the fax or whatever information they received, and the amount of time that takes to be able to do all of that in less than a minute is really a transformative prior authorization experience for your providers. And so if we turn now to prior authorization and talk about that for a little bit, one of the key issues around prior authorization today is the level of abandonment that happens when the patient arrives at the pharmacy and is turned away because prior authorization is required. So studies have shown that up to 40% of patients will end up abandoning their treatment when the PA is required. So not only are they not able to pick up their medication and they're frustrated and they don't understand why their provider didn't know that prior authorization was needed, they're at risk of having setbacks and readmission because they're not going to be on their medication. So being able to secure that prior authorization and make sure that when the patient arrives at the pharmacy that they can actually pick up their medication is really, really important. And that's what we've seen so far from our data, is that we're seeing an increased first fill adherence for providers that are using Surescripts electronic prior authorization. You'll see we've got about 1% increase here. We recently had a health system in Wisconsin that saw a 7% increase in their in-house pharmacy for their providers that were using EPA. So it really is a drastic change in making sure that if we can do that prior authorization prospectively, it's going to lead to some really significant benefits from an adherence standpoint down the road. So if we think about prospective prior authorization, as I had mentioned a little before, you're utilizing the same data that you have today, that eligibility and formulary data, and now that real-time prescription benefit data to identify during the e-prescribing process that prior authorization is required. So you can see that while you're sitting there with the patient, and then you can switch to a drug that doesn't require prior authorization, or know that if you pick a drug that does require prior authorization, you or your staff will be able to take care of that very quickly before the patient's even left the building. So once you have selected your target drug, you can launch that electronic prior authorization within your workflow, or if you want to have that queued up for a staff member, or if you've got a team of people that's responsible for prior authorizations, you can do that as well. So it's going to be flexible enough to allow you to make sure that the right person is getting notified of the need for prior authorization so they can get that taken care of. And then at the end of the day, that PBM will be able to adjudicate that prior authorization quickly, and you'll be able to send that clean prescription to the pharmacy so they can dispense that for the patient. And I think from a Surescripts and eClinicalWorks partnership perspective, being able to have this integrated directly into your eClinicalWorks e-prescribing platform is the most important thing, right? You don't want to be able to view this information outside of your workflow. You don't want to be able to see that prior authorization is needed and then get launched into an outside portal where you have to re-enter all of the information that you already know about the patient. So when you're able to see that a prior authorization is needed and you're sending that initial request to the PBM, eClinicalWorks is able to pull all of that information that they know about the patient and send that to the PBM already. So you're not going to have to re-enter the patient demographics and the provider information and the medication information and the insurance information. All of that is already within your eClinicalWorks application, and ECW will automatically send all that to the PBM in that first request, which allows the PBM in turn to return the exact criteria that you need to fill out. So everything is still within your workflow, and because the PBM knows exactly what criteria to return, they're able to embed some really nice logic within their electronic question set that allows you to skip irrelevant questions. So if you think about a prior authorization form, a lot of times you're just filling in all the information you know, and some of it might not actually be required based on the way that you answer some of these questions. And that's what EPA within eClinicalWorks will allow you to do. Is if question 1 is what's the patient's diagnosis, and you choose Parkinson's disease, you might get to skip 20 questions that you would have had to answer in the old way of doing things, but they no longer apply because of what you chose as a diagnosis. So the amount of time savings is significant, and we've seen that in studies that we've done with some of our partners too. So being able to see the active amount of time a user takes to process a prior authorization is cut in half by being able to do it electronically within your workflow. And also, as I mentioned, because everything is electronic, that allows better automation on the pharmacy benefit manager side, and they're able to send those real-time responses and let you know if the drug and the prior authorization is approved very, very quickly. So it really is a significant time saver. So we've seen some health systems that have gone from it taking over 3.5 days before they even start the prior authorization after they've written the prescription in the old way of doing things. And now they're getting things done and completed in, on average, in 1.4 days. And that's looking at all drugs. You know, sometimes drugs take a little bit longer if they're specialty drugs or more complicated criteria that users are filling out. Sometimes a PBM has to have people look at those. But on average, they were able to see a drastic decrease in the amount of time it took them to process prior authorizations. The health system I mentioned in Wisconsin was tracking very closely on the amount of overtime they had to pay employees that were simply doing prior authorizations every day, full time. And they were able to cut their costs by 51% of overtime costs when they moved to an electronic prior authorization workflow. And as I mentioned before, they saw a significant improvement in adherence at their in-house pharmacy. And that's something that was really important to them as well, because that meant that their revenue from their in-house pharmacy went up because their medications were being picked up more quickly and more often than they were doing a traditional prior authorization workflow. So this is not obviously a screenshot of how real-time prescription benefit looks within eClinicalWorks, but it's just a mock screenshot in a workflow that I'd like to share with you all, so you can see conceptually how this would look, and then you guys know that it's going to look much nicer when eClinicalWorks is putting this within the actual e-prescribing workflow. So as you can see, if I'm a provider and I'm trying to prescribe Prometrium for my patient, as I type that into my drug search, I'm presented with that typical information that I would see today as part of the e-prescribing process. So I can see my Prometrium, progesterone, and then igestin, and then I can see my SIG information down at the bottom of the screen and my patient information on the right-hand side of the screen. So as I'm typing Prometrium and I ping the PBM and see if I prescribe Prometrium, what would the patient have to pay at the point of care? That's when I can start to see some of these significant benefits. So eClinicalWorks will be able to show you patient-specific pricing for the requested drug and up to 5 therapeutic alternatives through those various channels. So as you can see, Prometrium is $133 at the retail pharmacy that I've selected, $388 for a 90-day supply, and then $361 for mail order. But it's the really key thing is that I can also be able to see some more detailed pricing information that the PBM is sending back. So if I click on my little hover over, I can now see what my out-of-pocket applied amount is, the remaining amount, and how much I've been applying on my deductible. So depending on how eClinicalWorks wants to do it, they'll do it in whatever way is best for you all. But you're going to have a lot of detailed information visible initially, and then you might be able to dig a little deeper and get some even more information, which is great. So you're going to have all the information you would need. And the other key thing too, I would just note, is that you can see in today's world, you would have no visibility into the fact that your progesterone is going to be that much cheaper than Prometrium, because if you're looking at traditional batch formulary, you could see, okay, Prometrium is on formulary. It might not be preferred, but maybe that's not that big of a deal, so I'll just prescribe that. But then when the patient got to the pharmacy, she would have had to pay $133. But now you can see that for progesterone, by just switching to generic, you'll be able to say, see a $5 out-of-pocket cost at the pharmacy rather than that $133. And then the other great thing too is that, as I mentioned, you're going to see all of those same coverage factors that you would see in traditional batch group level formulary, but you're going to be able to see them in a patient-specific way. So you'll be able to see that prior authorization is required, and then you can initiate that very easily from the screen, or I believe eClinicalWorks is going to automatically initiate that prior authorization and ensure that that gets done before the patient leaves the office. And then because everything is actionable that you're seeing here, you're not going to have to say, oh, okay, well, this is great information, and then have to jump through a lot of other hoops to make a switch. You're going to be able to make a quick change to whatever the alternative ends up being. So if you had Prometrium at retail and you see how much cheaper it is for 90-day at retail for progesterone, you can easily select that new alternative and then have that be the prescription that you're sending across to the pharmacy. So being able to have that actionable intelligence is the most important thing, and being able to have that conversation with the patient about the price that they would pay when they get to the pharmacy, that without this kind of technology, it's just impossible to have today. So you just have to, you're writing prescriptions somewhat in the dark, hoping for the best when the patient gets there. But now you're going to have all that information at your fingertips and be able to make better decisions for your patients. So if we look at how EPA will work within the eClinicalWorks workflow, as I mentioned, everything is right within the same workflow that you're used to seeing today. So as I'm writing an order for Abilify, I can see on my ordering screen that if I'm e-prescribing Abilify 1 tablet, I can see the prior authorization is required. I can see the pharmacy and all the other information that I see today through my common ordering screen. And then when I click on send, then I can send that prescription. But you can also see if prior authorization isn't required. So it's going to have a color coding to indicate if it's required or not. And then you can also select, if you uncheck the box, you'll be able to select and say, okay, I don't want to pursue PA if for whatever reason you decide you don't want to pursue it. So you're going to be able to have all that information about whether or not prior authorization is required as you're writing the prescription. And then if you decide to select that drug and do the prior authorization, you're going to have your jelly bean up here, and it's going to have a new category called prior authorizations. So I can use my existing jelly bean menu to select my prior authorization queue and be able to work my prior authorizations in the same way that you would work your refill requests or any other queue that you've got within that jelly bean. So I can see that I've started a prior authorization. It's in progress with my patient's insurance plan. You can see all the drug information, the facility, and then the date and the time that you initiated that. So that EPA process just becomes a very similar process that you're used to today, and everything can be managed and tracked and audited within your eClinicalWorks system. You don't have to go outside to a separate portal. And then the other thing that I alluded to before is that the nice thing about it being electronic is that all this information is now still within your workflow. So based on the way that I answer these questions, I get to skip the relevant questions. And so if I answer yes, no, maybe question 3 is no longer required, or question 4, and then I can just click submit. So ECW will have a really slick workflow where you only have to see and answer questions that are actually required based on the way that you've answered previous questions. And that's where that time savings comes in, being able to move from, on average, 22 minutes to process and answer questions for a prior authorization manually in a portal, versus being able to do things in, on average, a study showed 11 minutes with electronic prior authorization. And sometimes less. Sometimes, as you're all aware, all the PBM wants to know is what's the patient's diagnosis. So if that's all they need and you answer that question set, that's a very quick thing that you can answer and send off and get an immediate response on. So you don't have to worry that you don't really know all the information they need and are just answering as many as you can in a traditional paper form, when a lot of those wouldn't actually be required. And so as you can see here, I can get my approval back. And then if I click on this approved status, I would be able to see more details about the prior authorization approval. So they'll send all of that traditional information you would get in an approval letter from a PA. They'll send that all electronically, and oftentimes they'll attach a PDF of the approval letter as well. So you'll have that again within your system. And then in cases where I don't get approved or denied, sometimes the PBM will send back a closed status. So if electronic prior authorization, for whatever reason, isn't available for this drug or this health plan, the PBM can send that back. And then that also means that we at Surescripts try to find an alternative method to send you back something else. So if we're not connected to the PBM for whatever reason, we can still find a fillable PDF of that PA form and send that back that you'd be able to click and process within the ECW workflow as well. And then that denial reasons will all look similar to what you see today, but they'll all be viewable and trackable and saved to that patient's chart. So they're part of your system and not part of an outside system. And the other nice thing too, as you can see here, is I mentioned that audit trail. So you'll be able to see, if you need to look back and see what the chain of events was, you can see when you wrote the prescription, and then, when you received, the PBM received that PA, and just all of the different steps. So you can see when you got that question set back, when you sent the completed question set to the PBM, when you got the approval back, and then when you dispensed it to the pharmacy. So being able to see this entire history is really helpful from a troubleshooting and auditing perspective. And you'll always have full visibility into the life cycle of a specific electronic prior authorization combination. So when eClinicalWorks makes EPA and real-time prescription benefit available, you'll be able to utilize that eClinicalWorks product activation hub and select Surescripts from the list of applications you're able to activate. Right now, EPA will be available in the next eClinicalWorks release, hopefully in Q1 2019, and real-time prescription benefit will also likely be available during that time. So you could use the same activation hub and activate both services, or one service or the other, hopefully both services at the same time. So eClinicalWorks is making it very easy for all of you to activate these new services and be able to utilize them as part of your daily e-prescribing tasks and capabilities. So now I would love to take any questions that you guys have about either electronic prior authorization or real-time prescription benefit. Okay, so the first question that we have is, who determines what alternatives are sent back for the real-time prescription benefit? And that's a good question. So it's the PBM or the health plan, whoever is connected to Surescripts for that real-time prescription benefit service. They will be returning those alternatives back. So we're getting those directly from the PBM or health plan to identify what alternatives would be in line with that patient's pharmacy benefit. And then another question is, how fast do we get a response back from real-time prescription benefit? So what we've seen so far is that it happens in under 2 seconds, and that should get better and better, even more quick once PBMs and health plans get some further time under their belt. So we saw that with electronic prior authorization, which is a little bit older. It's been live in the market for about 3 years, but PBMs are continually making improvements to be able to return things more quickly. And so even though it's very, very fast at 2 seconds right now, I expect that to get better and better as PBMs increase their technological capabilities and their ability to collate all of the data they need to respond back with that price information across channels and therapeutic alternatives. One other question we've got is there an advantage to going with Surescripts for these products versus some other vendors? And what I would say to that is that the nice thing about these two solutions is that you're already utilizing Surescripts for some other important capabilities within e-prescribing. So you're already utilizing us for eligibility and formulary data and e-prescribing as a whole. And so what we're really just doing is layering on these two additional pieces of functionality to make that e-prescribing process even better than it is today. So all of these products work together, and we continue to work across product innovation to make sure that all of the products that touch e-prescribing within the clinical work system work really well, and we're enhancing them and making sure that they're as streamlined and easy to use as possible. So being able to have that visibility into eligibility and formulary data, we're working tirelessly with our PBM and health plan partners to keep increasing the quality and availability of that. And that has direct impacts into the success of real-time prescription benefit and EPA. So we make sure that all of those products are working well together and keeping you all within your typical workflow. So the next question is there a cost or activation fee associated with these solutions? And for that, I would just recommend you reach out to your eClinicalWorks SAM, and they'll be able to help you with any of those questions. And then we had another question about when will it be available in ECW. And that one is, it's being worked on for the first major release of Q1 2019. So EPA will be available then, and we expect real-time prescription benefit to be available then as well. But definitely continue to check with your SAM if you have further questions about when the products will be available. And then there's another question about, let's see, about access to the slides. I'll work with our marketing team and with Lisa to figure out how to get the slides made available after the webinar. So we'll have a discussion about that and make sure you guys can have this information. All right, it looks like that might be all of the questions we have. I'll give everybody a couple more minutes to ask any questions that might be outstanding before we wrap it up. Okay, so it looks like those are all of the questions we have. If you have any questions after the webinar is over, please feel free to reach out to your eClinicalWorks Sam or to Surescripts if you have anything you have questions about. We're happy to help. Otherwise, I will throw the webinar back over to Lisa to wrap us up for the day. Thanks everybody for coming.
Thanks, Luke. I appreciate it. And all of you, you're welcome to reach out to us, and I can forward any questions you may have to Luke and his team if there's any questions that pop up as a follow-up. I will work with them to show them how to get you the slides in the format they're going to need to do so. And then at any time, if you need any assistance, you can just reach out and let me know, and I can make sure your questions get to the people who need them. All right, so if there's no further questions, we're going to end the call here. We'd like to thank all of you for taking time out of your busy day to spend some of it with us, and we'll look forward to seeing you online in the future. Y'all have a great day and a wonderful rest of your week. Bye-bye.